Aortic Aneurysm. An aortic aneurysm is a balloon-like bulge in the aorta, the large artery that carries blood from the heart through the chest and torso. Aortic aneurysms can dissect or rupture. The force of blood pumping can split the layers of the artery wall, allowing blood to leak in between them. Sign and symptoms. Most intact aortic aneurysms do not produce symptoms. As they enlarge, symptoms such as abdominal pain and back pain may develop. Compression of nerve roots may cause leg pain or numbness. Untreated, aneurysms tend to become progressively larger, although the rate of enlargement is unpredictable for any individual. Rarely, clotted blood which lines most aortic aneurysms can break off and result in an embolus. Aneurysms can be found on physical examination. Medical imaging is necessary to confirm the diagnosis and to determine the anatomic extent of the aneurysm. In patients presenting with aneurysm of the arch of the aorta, a common sign is a hoarse voice from stretching of the left recurrent laryngeal nerve, a branch of the vagus nerve that winds around the aortic arch to supply the muscles of the larynx. Pathophysiology. An aortic aneurysm can occur as a result of trauma, infection, or, most commonly, from an intrinsic abnormality in the elastin and collagen components of the aortic wall. While definite genetic abnormalities were identified in true genetic syndromes associated with aortic aneurysms, both thoracic and abdominal aortic aneurysms demonstrate a strong genetic component in their etiology. Prevention. Don't use tobacco products. Quit smoking or chewing tobacco and avoid secondhand smoke. Eat a healthy diet. Keep your blood pressure and cholesterol under control. Get regular exercise. Treatment. The treatment of your aneurysm depends on how big it is. If it's less than 5 centimeters, or 2 inches, your doctor might try to treat it with medication first. They might prescribe drugs, such as beta blockers and calcium channel blockers to lower your blood pressure and relax your blood vessels. These medications will lessen the chance that your aneurysm will rupture or burst. Your doctor will continue to monitor you regularly to see whether or not your aneurysm is growing. They will also tell you to avoid heavy lifting, which puts pressure on your aorta. Surgery. If your aneurysm continues to grow and if you have symptoms, like chest, back, or jaw pain, your doctor may decide to perform surgery on you to remove the bulge. The most common type of surgery is open abdominal or chest repair, where the doctor opens up your chest or abdomen, depending on where the problem is, removes the bulge in your aorta, and replaces it with a fabric tube called a graft. A newer, less invasive procedure called endovascular repair involves guiding a device called a stent graft through the groin and to the site of the aneurysm. Your doctor places the stent graft, a wire frame sewn onto a fabric tube, inside the aorta, which lessens the pressure on the weakened artery walls. The type of procedure you have depends on your general health and where your aneurysm is located. A month to 6 weeks after surgery, you should be able to resume normal activities. Nursing intervention. Nursing care plan for clients with an aortic aneurysm is to modify risk factors, controlling the BP to prevent strain on the aneurysm, recognizing symptoms early, and preventing the occurrence of a rupture. Monitor vital signs. Assess risk factors for the arterial disease process. Obtain information regarding back or abdominal pain. Question the client regarding the sensation of palpation in the abdomen. Inspect the skin for the presence of vascular disease or breakdown. Check peripheral circulation, including pulses, temperature, and color. Observe for signs of rupture. Note any tenderness over the abdomen. Monitor for abdominal distension. Discharge and home health care guidelines. Wound care. Explain the need to keep the surgical wound clean and dry. Teach the patient to observe the wound and report to the physician any increased swelling, redness, drainage, odor, or separation of the wound edges. Also instruct the patient to notify the physician if a fever develops. Activity restriction. Instruct the patient to lift nothing heavier than 5 pounds for about 6 to 12 weeks and to avoid driving until her or his physician permits. Braking while driving may increase intra-abdominal pressure and disrupt the suture line. Most surgeons temporarily discourage activities that require pulling, pushing, or stretching activities such as vacuuming, changing sheets, playing tennis and golf, mowing grass, and chopping wood. Smoking cessation. Encourage the patient to stop smoking and to attend smoking cessation classes. Complications following surgery. Discuss with the patient the possibility of clot formation or graft blockage. Complications for patients not requiring surgery. Compliance with the regime of monitoring the size of the aneurysm by computed tomography over time is essential. The patient needs to understand the prescribed medication to control hypertension. Advise the patient to report abdominal fullness or back pain which may indicate a pending rupture.